This presentation is on schizophrenia and is being presented by Blankenship. The objectives of this lesson are to be able to identify the signs and symptoms of schizophrenia, to be able to recommend ways to manage schizophrenia, and to be able to explain how schizophrenia affects the patient. Schizophrenia refers to a group of severe, disabling psychiatric disorders marked by withdrawal from reality, illogical thinking, possible delusions and hallucinations, and emotional, behavioral, or intellectual disturbance. The level of functioning in work, interpersonal relationship, and self-care are markedly below the level since the onset of symptoms. Those with schizophrenia have difficulty distinguishing reality from fantasy. Their speech and behavior may frighten or mystify those around them. Some of you may ask why schizophrenia is such an important topic to learn about. Well, schizophrenia affects 1.2% of the population above the age of 18. This is estimated to be 51 million people worldwide. In the United States alone, 3.2 million Americans are affected by schizophrenia. Schizophrenia affects both men and women equally. Schizophrenia has a higher prevalence than multiple sclerosis. Schizophrenia occurs in all societies with no regard to race, color, or culture. Now imagine making it into nursing school. You're doing great, making wonderful grades, you have nice friends, a significant other that supports you, and a family that is very proud of all that you have accomplished. Suddenly your friends start noticing that you seem to get confused. Your statements aren't always making sense, and you haven't showered in a couple days. Family and friends think that you're stressed, it's finals, but you can't get the strange ideas out of your head. You think that your classmates are actually out to kill you and that your professors are helping with the plans. Soon you stop showing up to classes and you avoid your family and friends. You're getting easily agitated and your significant other leaves you. You're afraid your friends are out to get you, so you start ignoring them altogether. Eventually, your family finds you in the dark, staring at the wall and talking to yourself. You're taken to a psychiatrist and diagnosed with schizophrenia. Management of these new symptoms takes months, and you're kicked out of the nursing program. You don't understand what is happening to you, and you're scared of most of the people that you meet. You don't feel you need medication, and you don't take it. You start drinking and doing drugs to make the voices go away, and you distance yourself from your family. Just imagine one day being in your 20s with such a wonderful life ahead of you, and then it gets ruined with one non-curable diagnosis. The precise cause of schizophrenia is unknown, and there is no way to accurately predict who will develop schizophrenia. There is evidence that points to genetic factors, biomedical factors, and other various factors as being a potential cause of schizophrenia. It is believed that there are multiple genetic factors that are involved in the predisposition to schizophrenia. The manner of transmission of genetic predisposition is not clearly understood. Biomedical factors involve dopamine, serotonin, norepinephrine, and epinephrine. Excessive dopamine activity is linked to hallucinations, agitation, and delusions, while high norepinephrine is linked to positive symptoms of schizophrenia. Other factors include structural brain abnormalities such as enlarged ventricles, as you can see in the picture on the slide. Other factors also include developmental traits, including faulty neuronal connections, and other possible causes, such as maternal influenza during the second trimester of pregnancy, epilepsy of the temporal lobe, head injury, prenatal infections, perinatal complications, and environmental stressors. The basis for diagnosing schizophrenia is formed by mental status examination, psychiatric history, and careful clinical observation. There is no definitive diagnostic tool for schizophrenia, but certain tests like CT scans and MRIs may be ordered to find elevated ventricular to brain ratios in schizophrenic patients. This can actually be seen in the picture that is presented on the slide. Schizophrenia has symptoms that are placed into three categories, which include positive symptoms, negative symptoms, and cognitive symptoms. Positive symptoms are those that are present but should be absent. Negative symptoms reflect the absence of normal characteristics, and cognitive symptoms reflect the patient's abnormal thinking and poor decision-making behavior. Positive symptoms are those symptoms that are present but should be absent. They indicate that the patient has lost touch with reality. Positive symptoms include hallucinations and delusions. Hallucinations are the most common feature of schizophrenia. These involve hearing, seeing, smelling, tasting, and feeling touched by things in the absence of stimuli. An example is hearing voices that command the patient to do certain things, usually abusive and self-destructive. Delusions are fixed false beliefs. They cannot be changed by logic or persuasion. An example is a patient believing that people can read his mind. Several categories of delusions include persecutory delusions, reference delusions, and delusions of thought withdrawal/thought insertion. Persecutory delusions are where the patient thinks he is being tormented, followed, tricked, or spied on. Reference delusions is where the patient thinks that passages in books, music, TV shows, and other sources are directed at him. Delusions of thought withdrawal/thought insertion is where the patient believes others can read his own mind, his thoughts are being transmitted to others, or outside forces are imposing their thoughts or impulses on him. Negative symptoms are symptoms that reflect the absence of normal characteristics. Negative symptoms are removing something that should be there. Negative symptoms include apathy, anhedonia, blunted affect, and poverty of speech. Apathy is the lack of interest in people, things, and activities. Anhedonia is diminished capacity to feel pleasure. Blunted affect is characterized by the patient's face appearing immobile or inexpressive. This is the flattening of emotions and becomes more pronounced as the disease progresses. Poverty of speech is a speech that is brief and lacks content. Cognitive symptoms reflect the patient's abnormal thinking, poor decision-making skills, poor problem-solving skills, and the ability to communicate, and strange behavior. Cognitive symptoms include thought disorder and bizarre behavior. Thought disorder is characterized by confused thinking and speech, such as incoherent rambling, loose association, word salad, and wandering. Bizarre behavior includes childlike silliness, laughing or giggling, agitation, inappropriate appearance, hygiene, and conduct. Schizophrenia can be medically managed through drug therapy, electroconvulsive therapy, as well as other treatments. Schizophrenia is mainly treated by antipsychotic medications, which can prevent relapse of acute symptoms. Examples of these drugs include the typical or conventional typical antipsychotics and the atypical antipsychotics. Typical antipsychotics are known as first-generation antipsychotic drugs, while atypical antipsychotics are known as new-generation antipsychotics. Typical antipsychotics can cause extrapyramidal motor control disabilities, whereas atypical antipsychotics are less likely to cause that. Typical antipsychotics have more side effects than atypical antipsychotics. Typical antipsychotics have fewer withdrawal symptoms, whereas atypical antipsychotics have more withdrawal symptoms. Electroconvulsive therapy is rarely used, but is for patients with acute schizophrenia and those who can't tolerate or do not respond to medication. It is effective in reducing depressive and catatonic symptoms of schizophrenia. Other treatments include compliance promotion programs, psychosocial treatment and rehabilitation, vocational counseling, supportive psychotherapy, and appropriate use of community resources. These resources assist in ensuring that those with schizophrenia can stay in the community instead of being confined in an institution. As a nurse, there are multiple steps you can take in assisting a patient with schizophrenia. You can establish trust and rapport, maximize their level of functioning, promote social skills, ensure safety, ensure adequate nutrition, promote compliance and monitor drug therapy, encourage family involvement, and you can deal with hallucinations by presenting them with reality. Explore the content of their hallucinations, but avoid arguing about the hallucinations. Tell them you do not see, hear, smell, or feel it, but explain that you know that these hallucinations are real to them. In conclusion, those with schizophrenia have difficulty distinguishing reality. Schizophrenia is not a rare disease. We see it often. The cause of schizophrenia is not exactly known. As a nurse, you will at some point deal with someone who has schizophrenia. Schizophrenia has positive, negative, and cognitive symptoms. Schizophrenia should be diagnosed by a trained psychiatrist. Medical management typically consists of drug therapy, and there are many potential nursing interventions that can take place to assist someone that has schizophrenia, because nurses are at the front line of handling those with mental illness. To review what we have learned during this lesson, we're going to go over a case study. Bob Tyler, a 40-year-old male, is brought to the emergency department by the police after being violent with his father. Bob has multiple past hospitalizations and treatments for schizophrenia. Bob believes that the healthcare providers are FBI agents and his apartment is a site for slave trading. He believes that the FBI has cameras in his apartment to monitor his moves and to broadcast them on TV. Now, one of the first things that we're going to do with Bob when he comes into the hospital is we're going to establish a rapport with him. This man is paranoid and has a history of being violent due to his delusions. By building a rapport with the patient, he may be more likely to comply during his stay. We also want to provide therapeutic communication with him. Also, you want to remember that on the NCLEX to pay attention to the least restrictive measure when handling a psychiatric patient. Don't necessarily go. If there are any questions, feel free to ask them now, or you can come to me after class and ask them, or you can send me an email regarding any of your questions. Please refer to my references for any other information regarding schizophrenia.